each joint, but there'll be certain times that I do stand to try to engage my body weight into the joint mobilization, okay? So obviously if there's any kind of restriction in pronation, supination, full flexion with overpressure, or full extension, that's when you want to be concerned that we've got a potential joint problem that we'll actually need to mobilize something. So the first thing you can do, this one you could do sitting or standing, but you're going to rest the forearm with a little bit of that supination, and you're going to mobilize the ulno humeral joint. So that means that this hand needs to stabilize the humerus, and this hand is going to be kind of in a lumbrical grip on the ulna. Okay, so his arm and hand is resting on my shoulder, and all we're going to do, again, it's about that sort of 70 degrees of flexion, is that loose pack position, really nice amount of flexion in there, and all I'm going to do is take the ulna and bring it towards my body. Okay, so I'm not going towards his hand. Okay, that would be an inferior glide. I'm doing a distraction from the joint. So I want to take up all the slack through his tissue, and then I'm going to put a little bit of traction through the joint, like I'm pulling it towards me. Okay, so we're going to hold that courtesy distraction, 30 seconds, 45 seconds, whatever your hands can do, but we want to stabilize the upper and pull through the ulna as if it's coming this way towards my body. Okay, so there's your ulnar distraction. It's usually the first one that I do, knowing that I do have a joint restriction because it is that courtesy traction. Now with the lateral glide, this one is going to be used for somebody with lateral epicondylalgia or some kind of epicondylitis or lateral epicondylitis or extensor tendinopathy. Usually there's an issue where the joint can't come laterally. So what we'll do for this is I will stand, and then, okay, so I'm going to put his arm between me and my arm. So I'm going to stabilize him. I'm going to take my upper hand and block his humerus with my bottom hand is going to take the whole entire joint. And so what I'm going to do, now you see my elbows, I've separated them. I started here and I've come and I've separated them, but he's still against my body here. So as I go and I create that lateral distraction and lateral glide, the hand isn't moving because I've blocked it with my body. Okay, so what we want to do again is take the whole entire joint and we're going to push it laterally while this hand creates a counter force going medially. That's how we're going to gap the radius there. Okay, so that's a lateral glide. You're doing this. Okay, and that's of the ulnohumeral lateral glide. Then we've got a medial glide. So all you do for that is you change position. You're now between him and his arm, and you're going to just do the opposite. You're going to take this as your counterforce hand and this as your mobilizing hand going medial. Now that would be for somebody more with a medial epicondylitis issue or flexor tendinopathy. Okay, typically they get stuck and it doesn't go medially. Okay, so those are those two joints, pretty easy. Now you could, if you had enough hand strength, create a distraction and then you can always add a grade 1 distraction before any joint mobilization if you can hold it. Okay, so inferior radial glides. Let me make sure I did that. Yeah, okay. So inferior radial glides, these are pretty simple because all you're going to do is stabilize that arm, the upper arm. You're going to hold his radius. Now you can do this in one of two ways. You can, I like to do again this like lumbrical grip, holding the radius. You don't need to hold his whole arm because you're going to pull ulna and radius. So I'm on the radial side. I'm going to stabilize again this upper arm, and all I'm going to do here is I'm just going to kind of lean back a little bit. Okay? I'm going to sort of shift my body weight back, which is going to take the whole radius into an inferior glide. Okay? So it's a nice easy glide. You just stand up from that, you sort of lean into it, and then again you're holding for that certain amount of time that you want to do your mobilization. Then from there you're going to do a superior glide. That's going to be what we call a sawmiller's grip. So you're going to take hand in hand and you're going to put him into some extension in the wrist. Again, we're going to stabilize up here, and now my force is going to come right through his forearm, okay? So you just have to make sure you're lined up properly. So if it feels more comfortable, you drop your table a little bit so that you can get into that joint. So again, it looks like this, and we're just going to push right through. And so where I'm pushing is to get the radius. I'm pushing through his thenar eminence into his radius with my hand. Okay, so you want to make sure that you're getting the mobilization. Okay, and it's going to feel like he's kind of going into the table. So we've got radial, inferior, and superior is just going to change your grip to the sawmiller's grip. From there, we're going to do a very specific radial humeral joint glide. For this, I'm going to sit back down. So you just think about, what are you moving? So we need to stabilize the humerus and grip the radius, okay? And all I'm going to try to do, now remember, all that flesh and all that muscle in here, you've got to find where his radial head is. So we're going to kind of grip them together. You see in the photo, the hands are really close together. And all I'm going to try to do is do an anterior and a posterior direction. So I'm going to push towards his body, and I'm going to pull towards my body. Okay, so it's into him and to me. Anterior, posterior. Okay? Because of the way I've got his arm situated, that's anatomically correct. Okay, so don't confuse yourself that that's like medial or lateral, right? Because really when you're taking that like this, based on his hand position, that's anatomically correct, anterior, posterior. You got me? So I want to take it and I want to push it towards him, and I want to pull it towards me, and I want to feel that motion that's in there. Then what you're going to do, look at the hand positions here for proximal radial ulnar. So I am going to come under to hold ulna, over to hold radius. And you see on the bottom photo, it's the inside view of what my fingers look like. So they should be like this, next to each other, okay? So I'm gonna cup his arm on top here, and again I'm going to try to push towards him while stabilizing underneath on the ulna, and I'm going to pull it towards me for the posterior glide while stabilizing on the ulna. So I'm trying to separate between the interossi that are in the ulna and radius of the proximal joint. You got me? So it's very similar to this. It's the same kind of concept, but my stabilizing hand, because I'm on the proximal radial ulnar joint, has to be on the ulna, okay? And then lastly, let's have you sit up, Sam, that way. Drape your feet off towards breaking your hip, and let your hand, and you can scoot back so you feel like supported, and his hand dangles. So when I'm in the clinic, you know, we have the smaller tables, right? So once they're done, I'm done laying them down. I just sit them up and I tell them to straddle the table. So their arm is dangling, because what you want is the arm to be free here. If it's resting on the table, you're not going to get the angles that you want. So we want them totally hanging off. And then there's 3 really nice techniques here that overlap what we just did. There's the olecranon. So I want you to think about the olecranon here as an actual joint. It's a hinge, right? It's like your knee. And it tracks like the patella tracks. So this has to track properly. Has anybody ever, like, you felt something funny and you sort of popped your own elbow, right? That's a tracking issue, that it got a little bit off track and you just sort of had to pop it and you hear it like manipulate. This is the same thing with people with elbow issues, with tennis elbow or golfer's elbow, is that this can get a little bit off track for them. So what we want to do, like you see in the picture, we want to always stabilize the inside section of the arm. So I've got pretty much the distal humerus and then the proximal ulna. And I've got it really in my hand, okay? Then I'm going to take my thumb and I'm going to come on top. And this little circle down here, it's to mimic for you like a clock. So we've got 12 o'clock on the top arrow, 1 o'clock, 11 o'clock, 2, 3, you got me? So the top end of your clock. And what I want you to do is hook your thumb on top of that clock and pull down into 12 o'clock. Go to 1 and pull down. Go to 2 and pull down and in. Go to 3 and push over. Then go to 11 and pull down and across. Go to 10, pull down and across. Go to 9, push straight across. And you're going to feel as you do this, there's going to be one side of that olecranon that is stiffer than the other side. That's what you want to mobilize, okay? You want to feel like when I kind of push down on him, I feel a little bit of give, but I really feel a nice give at 1, at 2, I really feel it, at 3, he really likes to move this way. What he doesn't like to do is come outward. So when I'm at 11, I feel almost nothing. Can you feel that? Like it just doesn't, you're sort of just locked. I'm hitting a wall. It just doesn't want to go. So what I'm going to do is make sure my thumb is in the right spot, and I'm going to try to give him a little bit of a nudge to start moving into that plane a little bit, to just get him on track a little bit better. Okay? So sometimes you might need to do 2 if you feel like, you can't really quite grab it. But then you're going to sacrifice your stabilizing hand. But if that's what you have to do, then that's okay. Okay, but I try to always kind of keep my hand supported so that I can pull across. You feel that? It just doesn't quite go. So typically with an epicondylitis issue, there's going to be a restriction somewhere on that top end of that clock. And you just want to nudge it enough to get some motion in there. Now remember, it's not going to move a lot because it's a very secure hinge joint. And there's a lot of bone in there. But we just want it to move a little bit.
So that's not something that you would like think to look for. You just always check that.
Always just check it.
Okay.
Yeah. It was a clinical pearl that when I took one of an advanced manual therapy class, they introduced this whole sequence, and after that I was like, why have we not learned this sooner? Because it was just so easy and it worked.
So the clock is your assessment, and then you treat based on
whatever was stiff around that clock. Exactly. Okay, so then while he's still here and hanging, what we can do is we can mobilize the radial head, okay? You saw me mobilize the radius. I pulled on it and then I pushed it inferior, superior. And then you saw me doing a little anterior, posterior when my hands were like this. Here's another really nice way to do it. You still want to stabilize ulna and humerus, and then I want to come in here and I want to find his radial head. Now from the back, it's really easy to palpate. What you have to do is you got to get through the front. There's a lot of soft tissue in there, and you don't want to be so pinchy and grabby, especially somebody who already has some pain here. So what you want to do is you want to find the radial head, and then what I want to do is 3 different directions. I want to hook on top of it and pull it down. I want to get right underneath it and push it up. I want to get right behind it and push it forward. Okay, I want to take it and I want to pull it back towards me, and then I